Howdy, name's Johnny Ray, and today I'm going to be talking about the symptoms of MPS II. Even though I do have MPS II, I just want to say I don't know everything about it. Um, I'm still learning as I go in life, and just doing these videos, I'm figuring out what could happen to me, and even from recent doctor's visits. So let's just go ahead and go over what I have at least experienced so far. All right, so the table is repeated in the paragraph in the symptom section, so I'll just skip over what's repeated. So first up in general symptoms is reduced endurance, which I don't think I have reduced endurance. It's more so the pain that I'm feeling that day. With eyes, I definitely do have vision problems, along with finding out last year that I have another another rare genetic disease called retinitis pigmentosa. I want to talk to my retina doctor about that because I looked it up and apparently there's some overlapping symptoms with MPS II and RP, so I just want to get further information to make sure that I do have RP or if it's just MPS II. For physical appearance, you can definitely tell that I have this just looking at me with the abnormal facial features, the large head. I am short at 5'1". I'm not sure what it means by bent over stance really. I do know I have a different posture whenever I'm walking, so maybe that's what it means. For the gastrointestinal system, I do know that I have an enlarged liver and spleen, but I didn't really confirm that for myself until later in life. And then I know I had hernias with I was a baby, but I don't know which ones. For respiratory, the only lung problem that I can currently have is with anesthesia, which anesthesia is mentioned later on in this booklet, but not in the symptoms section. But there, I have to warn my surgeons about MPS II and anesthesia because it's such a high risk for something to happen just because of my tight airways. And then I also have sleep apnea. For brain and nerve, the only problems that I have in this section are carpal tunnel syndrome, which I can show you real quick. I've had surgery in both wrists. Then I do have compression of the cervical spinal cord. For mouth and teeth, lips and tongue are already mentioned in the physical appearance. I don't think my teeth are abnormal, or at least my dentist haven't told me that they are. The only thing they see that's not normal is that I can't open my mouth as wide. For ears, nose, and throat, I used to get a lot of ear infections when I was a kid. I do wear hearing aids for my hearing loss. And then I used to have sinus infections often. For my heart, I don't have any issues that I know of. But last year, my doctor told me that I have slightly thickened mitral valve leaflets, which are nothing to worry about. And then during my first porticast surgery, there was something about a leaky valve, but I can't remember for sure because I was 10 years old whenever I had that surgery, and I'm almost 30 now. Then the musculoskeletal system is where all of my pain comes from. I definitely have joint stiffness. For abnormal hip formation, that's where a lot of my pain comes from, because a normal hip joint is supposed to be a half ball kind of shape, but for me, it's a rounded square kind of shape. And because of that, my doctor told me that it's scraping a lot in the socket, so that's why it's so painful. But my doctor told me that they don't want to perform hip surgery on me because of how young I am, and they want to wait until it becomes unbearably painful to deal with it. Then bone deformities in the spine. I actually just confirmed this in the last couple of years that I have mild scoliosis and spinal stenosis. I do have knee problems, but not knock knees. We're done with the table, and now it's on to the paragraph starting with skin. I don't remember what my skin felt like before I started taking my infusions, but I do remember my family saying that my skin used to be tough, and because of that, it made it harder to draw blood. But there's still nurses that still have a difficult time drawing blood from me. Um, I forgot to mention the symptom with the eyes that I wanted to talk about that overlap with the retinitis pigmentosa, which is the retinal degeneration, difficulty seeing in the dark, and reduced peripheral vision. In the ears paragraph section, it has new information about the kind of deafness. Unfortunately, I don't know the deafness that I have, mainly because I didn't know that there were different kinds of deafness, so I couldn't ask the doctor, or the doctor never mentioned it to me. I used to have ear tubes up until a couple years ago, whenever I saw a new ENT specialist, and whenever he removed the one that I still had, I actually ended up regaining just the slightest bit of my hearing back, but it wasn't really enough to do anything. Even though it doesn't mention it here in the nose part, I just wanted to go ahead and bring it up. I did used to have a more difficult time breathing through my nose due to a deviated septum, but I was able to fix that with surgery. For the respiratory system, I don't remember any mention of chest issues to me from any doctors, but I probably did have them because I used to get pneumonia almost every year whenever I was a kid. Sleep apnea was already mentioned earlier, but whenever I was a kid, I used to use a CPAP and I hated it. And then I tried and using a CPAP again a couple years ago. I still hated it because I would get interrupted sleep. I would only get 4 hours of sleep before getting interrupted by the CPAP machine. So as of now, I haven't figured out the next step to treating the sleep apnea. Back in the gastrointestinal system, it brings up new information talking about the bowel problems. My bowels can be troublesome, but last year it was just bad. But luckily, I was able to get it under control with some medication and a diet change. Back in the musculoskeletal system, here it talks about slippage of the vertebrae, which I did have a slip disc, but luckily I was able to get that fixed with surgery. Now, while we have already talked about joint stiffness, it mentions here limited range of motion. It says here with the limited movement that it can make dressing difficult. For me, it mainly makes it difficult for whenever I'm, say, putting on a suit jacket or tying my shoes. The walking on toes thing is something I still do to this day. But when I was a kid, my parents would always tell me to walk flat footed as much as they could. I just couldn't help but do it since it was habit. But as I've gotten older, I catch myself to try and walk flat on my feet, and it makes it easier to do that whenever I'm wearing my shoes. I definitely have the claw hand. Take a look. I've never been able to straighten my hand out, but I don't really see this as a problem. This one was a problem when I was growing up because I couldn't just walk into a store and pick out shoes. I always had to special order them online. At one point when I was a kid, I even went to a foot doctor that specialized in making bigger shoes, and my foot was almost too big for the mold box that he brought out. Luckily, nowadays there's wide shoes available that are not too terribly expensive. They're still around $100, but it's better than what my parents used to pay when I was a kid. I think that about covers all the symptoms that I've experienced so far in my life with MPS II. Hopefully, I went over it pretty okay. If not, go ahead and drop your questions in the comments. See you next time.